Let's get into that section of the show now. While gender-based violence, or GBV, is largely experienced as violence against heterosexual or cisgender women, it can affect all people, including LGBTQIAQ plus people. To unpack the experiences of GBV within the LGBTQI plus community, the complexities, the stigma, we now speak to medical doctor, queer mental wellness advocate, and an award-winning social entrepreneur, Dr. Dulcy Rakumakoe, CEO of Quadcare Healthcare Services. Dr. Rakumakoe, thank you for joining us. How are you this Tuesday?
Thank you so much for having me, Asanda. I'm blessed and happy to be here.
Thank you. We are blessed to have your community joining us and also talking about this particular community, rather. In Africa, what are the key factors? Let's start here, Doctor, that influence levels of GBV or gender-based violence within the intersection of gender identities that fall under the LGBTQI plus peoples.
All right. So number one, it's criminalization. So in many parts of Africa, it is still not seen as criminal, to be a member of the LGBTI community. Some people even getting killed with police impunity, because it is not law. The police, can look away while people do anything that they want to do. We also have gender norms, in Africa that everyone is meant or is supposed to be abiding by, patriarchy. There's religious fundamentalism as well. A lot of people are rejected by their families or even pushed into forced marriages. There's economics involved, economic marginalization, with housing insecurity in a lot of instances. And there's poor legal protection, and leading to stigma that's happening, especially in health services, in schools and in workplaces. So the factors are really multiple, and they're all contributing to these high levels of GBV, against the LGBTIQ plus people in Africa.
What are the major type of GBV cases that get reported amongst this group?
Okay, number one, corrective rape. Corrective rape is a big one, especially against lesbian women, and it happens even in South Africa. It does happen where we say we have a constitution that protects people who are sex and gender diverse. This still happens. Sexual assault is a big one. There's intimate partner violence, also within the community. So queer couples, there's violence that happens there, and it's very difficult for people to go and report these, because of the discrimination they face in law enforcement services. There's family abuse that happens with some people, kicked out of their homes, hate crimes, street violence that happens against trans, intersex people, and also gay men. There's police harassment that happens, especially when people are found, in after hours and without other members of the community seeing you still get people who are harassed by the police. And there's also then finally workplace discrimination that happens and often linked to violence as well.
How important is the language used to describe the relationship between what is assigned at birth and one's personal sense of gender when it comes to better understanding the LGBTQI plus community and in thus then tackling the issue of gender-based violence they experience?
Okay, language is important. Language is crucial. It shows respect. If you think, as an example, a woman that is married would be offended if they are not called Mrs., for instance, and when language is properly used, we reduce stigma, we are able to guide service provision, and we improve on justice responses when we use the right language to describe people. And using the correct pronouns, for instance, it builds trust. People can develop trust for the system. And when there's misgendering that happens, there's high risk and of violence that happens, of discrimination that happens. And there's also high risk of underreporting of situations where people are violated.
Does the system of assigning gender at birth on medical terms prove problematic for intersex individuals later on in life? in, say, adolescence, for example, and how can that be resolved?
Okay, so like the biggest problem, with assigning gender, to intersex people when they are born is number one, there's non-consensual surgeries that happen. Parents decide what gender or what sex they want the child to be, and surgery is then done on this child. Now the child grows up also with incorrect documentation. They're exposed to stigma. Then they're later exposed to mental and even physical harm. And how we fix this? Number one, we defer these non-urgent surgeries, so that we can allow people to give informed consent for any procedures, done on their bodies. And we should also start having a legal recognition of that intersex status, and start working with our home affairs, to make sure that the document updates and changes process is as seamless as it can be. Currently, people wait for even up to 2 years to get correct documentation from Home Affairs, and this affects their chances of maybe getting gainful employment. This affects their chances of opening bank accounts. Something as simple as opening a bank account is difficult for someone who does not have proper documentation. So a lot of work still needs to be done in making sure that as a country, and also as the continent, we have proper legal recognition of the intersex status.
Do gender constructs and categories change over time and across cultures? And how should this be attributed to how we formulate strategies for dealing with gender-based violence?
Okay, gender is said to be, it's culturally dynamic, and we need to have strategies that are locally grounded, that are historically aware, and co-designed with communities. When communities are educated and taught of what does being sex and gender diverse mean, communities are able to sit down together and just co-create systems, or come up with strategies that speak to those communities, and we just avoid a one-size-fits-all approach. We are diverse and different as people in the different parts of the continent, and we need to recognize those diversities when we come up with strategies to make sure that everyone feels safe in our communities.
What are some of the civil society groups that focus on support and interventions for victims and survivors of gender-based violence within the LGBTQI plus community? Let's talk on regional level as well as international level.
Okay, so on regional level, we have, ILGA, International Lesbian and Gay Association. We have the Coalition of African Lesbians, which is called CAL. In South Africa, we also have FEW, Forum for the Empowerment of Women in South Africa. We have the Strategic Litigation in Africa, IRANTI, that looks at especially at the transgender and the intersex people, gender dynamics as well. Triangle Project. We have Access Chapter 2. So we have many of these organizations that exist in South Africa, and in Nigeria, there's the Initiative for Equal Rights. And in Uganda, you have the HRAPF. In Zimbabwe, you have the Queer Alliance. And we have human rights awareness groups that exist as well in Kenya and Tanzania. And on the international front, we have the Outright International, we have Amnesty International, Human Rights Watch, Rainbow Railroad, Frontline Defenders, Red Umbrella Fund. And these organizations, all of them exist to create a world that is safe for the sex and gender diverse people.
Doctor, thank you so much again for your time. We appreciate your insights and educating us on an important matter.
Thank you so much for having me, Asanda. Have a good day.
You too. Thank you. Dr. Dulcy Rakumakoe is CEO of Quadcare Healthcare Services, talking to us about gender-based violence within the LGBTQI plus community. And coming up after Rise and Shine on Channel Africa is